A community that fails and thrives. A community that saves dreams, passion, and purpose. This is Pagtatap in the New Normal. Widening the reach of Provincial Government of Aklan's mental health program in 2020, the Provincial Government of Aklan launched Pagtatap program for its employees to shed light on the importance of mental health in enabling employees to cope with stress of life, work productively, and make positive contributions to their workplace and society. What happens after the pandemic? Studies have shown that after the COVID-19 global health crisis, the difficulty to re-engage with the new normal has become a stressor to a lot of people, which may lead to complex mental health issues. In 2021, as COVID-19 pandemic affects other sectors in the province, PG Aklan opens its services to the community to continuously promote and nurture mental health. Pagtatap is high impact. It is aligned to the following Sustainable Development Goals, Philippine Development Plan of 2017 to 2022, National Action Plan Against COVID-19, Sendai Framework for Disaster Resilient Communities. Pagtatap is effective. PG Aklan's approved and institutionalized Pagtatap program addresses the following service delivery gaps: inadequate competencies to provide psychosocial support services to the community, absence of province-wide policy on mental health, unavailability of safe space for employees to share their emotional and mental health issues and concerns, inadequate information and lack of awareness on mental health. The program's main goal is to promote mental health in physical and virtual spaces. As of June 30, 2022, PG Aklan Psychosocial Support Team has implemented various mental health awareness and sessions to employees. Mental health awareness to all employees from different departments and offices. Conducted stress management, psychosocial and debriefing sessions and workshops to employees. Working conditions have always been challenging for healthcare workers, even before the pandemic. That's why protecting their mental health and well-being is a priority. Conducted a mental health activity to all PHO personnel, capacitated healthcare workers from 9 LGUs who provide psychosocial support to pregnant, birthing, and lactating mothers in partnership with World Health Organization and Korean International Cooperative Agency. Conducted mental health awareness to rural health units and barangay councils of municipality of Madalag, Balete, Leso, Numancia, Calibo, and Batan. Conducted a mental health talk during Buddhist Congress in municipality of Altabas. It is highly important to raise mental health awareness in schools since students and teachers are seriously affected by mental health issues every day. Under the Pagtatap program, the following activities were conducted: psychosocial support sessions to youth leaders from 17 municipalities, orientation to youth experiencing behavioral problems as requested by Calibo PNP, psychoeducation webinar series to Red Cross Youth Aklan, including guidance counselors and DepEd New Washington, session on suicide prevention and handling stress and anxiety in time of pandemic to students from Melchor Memorial School, psychological first aid to 72 non-teaching staff and 3,252 teachers of DepEd Aklan and to 28 teachers from Guadalupe and Alfonso XII National High School. Mental health awareness to students and teachers of various private and public schools in Aklan. The issue of mental health during disasters is a new introduction to disaster risk reduction and management. Hence, capacitating responders and rescuers is also vital. To address their needs, the following were implemented: mental health sessions to 66 MDRRMO employees of LGU Ibahay, a 3-day capacity development training to 24 MDRRMO responders and stakeholders from LGU Batan on basic rescue operations, psychosocial awareness, and stress management. During the pandemic, suicide cases in Aklan increased. As a response, the following were initiated. A suicide prevention and psychosocial support session was conducted to beach guards of LGU Malay, to employees of Eurotel, lifeguards of Paradise Hotel, and staff of Girl Scout of the Philippines Aklan Chapter. Strengthen information dissemination on suicide prevention for radio guesting. The psychosocial support team and other mental health advocates have continuously attended various competency development interventions to improve mental health services. Mental health and psychosocial support services training of trainers by Department of Health, Regional Public Mental Health Convention, Mental Health Gap Action Program training, mental health crisis hotline training, learning sessions facilitated by specialized mental health professionals entitled Thriving Through Tough Times, Understanding Non-Suicidal Self-Injury and Cognitive Behavioral Therapy to Psychosocial Support Team, mental health advocates, and youth volunteers. With these accomplishments, the program was recognized by the Department of Interior and Local Government, DILG, as one of the governance models on service delivery. Pagtatap is sustainable and replicable. Sangguniang Panalawigan has approved a mental health ordinance, an ordinance institutionalizing and promoting the mental health in the province of Aklan, appropriating funds therefore and for other purposes. Moreover, PG Aklan's mental health plan was institutionalized through SP Resolution number 2020-769, while Executive Order number 038 institutionalized and governance, structure, and psychosocial support team composed by selected employees from different offices and hospitals. It was also included in the annual investment program, annual local budget plan, human resource development plan, welfare and benefits program, and learning and development programs and local investment plan for health. PG Aklan's mental health program can be implemented in 12 months with 471,000 pesos budget. Under the mental health bond, implementation, risk and management, and communication plans were embedded to provide detailed steps on how to install the program. Pagtatap program is innovative. A guidebook in delivering different mental health services was also created to aid different LGUs in implementation of various mental health and psychosocial support services. It maximizes the use of technology and social media. Pagtatap program promotes and strengthens volunteerism. Under the Pagtatap program, the creation of psychosocial support team was made possible for the 23 volunteers from 10 offices of PG Aklan. The team responds to the social and emotional needs of PG Aklan employees. Pagtatap provides an opportunity for people's participation. People's participation is encouraged and sought during the planning, organizing, and implementing of various services under the Pagtatap program. The following institutions and organizations provided support to the program: different LGUs in Aklan, different private and non-private educational institutions, non-governmental organizations, Project Kaleidoscope, Thrive Hive PH, Aklan Medical Society, Civil Service Commission, Department of Health, Korean International Cooperation Agency, Aklanon Youth Volunteers. The program provided a venue for the participants to share their stories, thoughts, and emotions. The participants also felt being listened to and cared for, hence, resulted to satisfaction to the program. Overall, PG Aklan's Pagtatap program in the new normal continuously reshapes and spaces that influence mental health, including homes, community, schools, workplaces, and healthcare services. Investment into mental health is an investment into a better life and future for all.